mid-1980s to 2000 in public health.
So the focus of the mid-1980s to 2000, the focus of this era in public health was health promotion and disease prevention. There was a focus on individual behavior and disease detection in vulnerable and general populations. Health promotion was also beginning to be put on the community rather than the individual. So public health really wanted to focus on how can we promote health within the community rather than putting all the responsibility on an individual. A huge focus shifted to disease prevention. So public health wanted to know how can we prevent diseases from affecting a population, which is why disease prevention is so big in this time. And then lastly, being able to detect diseases in communities, which I will discuss later on, was a huge focus in this era. Also bringing in, multiple screening, free testing, and all of that. Next, I looked onto CDC's website, who provided a timeline throughout this era. In 1986, the CDC co-sponsored the first national conference on chronic disease prevention and control, so there's the start to disease prevention. In 1988, Disabilities Prevention Program is developed to provide a national focus for the prevention of disabilities, so again, prevention. CDC establishes the Center for Chronic Disease Prevention and Health Promotion to target chronic diseases. So the CDC is beginning to do some health promotion. In 1991, the CDC established the Division of Oral Health to expand efforts to prevent oral disease. So it's even expanding into different fields of health. And conditions, development of a national strategic plan for early detection and control of breast and cervical cancers among all American women. So this is that disease detection that was important in this era. In 1992, the CDC was renamed the Centers for Disease Control and Prevention. So they brought in that prevention, that was important. In 1993, the CDC responds by developing prevention and information materials for the disease hantavirus infection. So for a specific disease in this time, they were bringing materials and information to prevent the disease. In 1994, Vaccines for Children program established, so they tried to give opportunities to provide vaccines for children and other sort of things to try to prevent disease and promote health. In 1995, the CDC recommended offering HIV testing to all pregnant women, and the emerging infections programs are established. So for the HIV testing to all pregnant women, again, this is detecting diseases and finding a way to hopefully prevent it from spreading. Then in 1996, Prevention Effectiveness Program and the Guide to Community Preventive Services External Icon was initiated. So disease detection in vulnerable and general populations is a huge focus of this era. How can you detect disease in both vulnerable and general populations? So one thing that they started doing was multiple screening, which is basically multiple tests being done simultaneously at the same time. So when you are getting blood drawn, any sort of test, you're able to test for multiple diseases at a time. So that was a major way of detecting diseases more often and more efficiently. Providing free testing for diseases. So whether it be through the health department, Planned Parenthood, free clinics, they started offering free testing to be able to get a better idea of where diseases may be detected in that population. Promoting healthy living in communities. So by putting up no smoking signs, disease prevention education, washing hands, all of that can be used to detect that there may be less disease in this area. So I think that had a little bit to do with that. Educating on self-examination. So for example, self-breast exam. If a woman knows how to do a self-breast exam and sees something a little out of the ordinary, a breast lump or something, then we can hopefully detect what's going on a lot sooner. So that has to do with that disease detection. And lastly, for general populations, promoting yearly blood work, yearly checkups, and going into the doctor when you're having symptoms. That is a lot of a quicker way to detect diseases in just general populations that are not necessarily vulnerable. So during this era, systems were developed or focused to protect individuals from dangers posed by unapproved food additives, pesticides, food contaminants, and drugs. This obviously closely associated with the FDA. Systems were also focused on promoting healthy living and protecting against diseases. So again, the FDA, the HRSA, which improves access to healthcare, the AHRQ, which promoted healthcare being safer, higher quality, more access to healthcare, the NIHA, which is basically a medical research agency, and then HICPAC, which provided guidance and advice to DHHS and the CDC. So those were development and use of systems was big in this era as well.
Clinical and population-oriented prevention. What is it? It is a framework that provides a common core of knowledge for clinical health professions and individual and population-oriented prevention and health promotion efforts. It can support interprofessional prevention education and practice. Geoffrey Rose, in his population perspective, he had three realities to development of effective population-based prevention strategies. They include disease risk, population, high or low risk, individuals' risk of illness. Disease risk is currently conceived as a continuum rather than a dichotomy. There's no clear division between risk for disease and no risk for disease with regard to levels of blood pressure, cholesterol, alcohol consumption, etc. Any population model of prevention should be built in recognition that there are degrees of risk rather than just two extremities of exposure. High or low risk. Rose observed that exposure of a large number of people to a small risk can yield a more absolute number of cases of condition than exposure of a small number of people to a high risk. Individual risk of illness. An individual's risk of illness cannot be considered in isolation from the disease risk for the population to which he or she belongs. This leading to someone in the U.S. is more likely to die prematurely from a heart attack than someone living in Japan due to the population distribution of high cholesterol in the U.S. as a whole is higher than the distribution in Japan. In the mid-1980s to 2000s for AIDS and HIV. In 1981, cases of rare lung infection called PCP were found in 5 previously healthy gay men in LA. The first cases of PCP were reported at the end of 1981, and it was normally found in people who injected drugs. By the end of this year, 270 cases were reported of immune-deficient gay men, and 121 of them had died. In March of 1985, the U.S. Food and Drug Administration licensed the first commercial blood test. This blood test was known as ELSA, and it was used to detect antibodies in blood for HIV. Blood banks also started to begin screening the U.S. blood supply. And the first International AIDS Conference was held in Atlanta, Georgia. Rock Hudson became the first high-profile fatality due to HIV, and he left $250,000 to set up the American Foundation for AIDS Research. By the end of this year, 20,303 cases have been reported. In 1990, the International AIDS Conference protested against the USA's immigration policy. In this conference, the protest stopped people with HIV from entering the country. The Americans with Disabilities Act prohibited discrimination to those living with HIV, and over 307,000 cases have been reported by the end of this year. In 1995, the FDA approved the first protease inhibitor, beginning a new era of highly active anti-retrieval treatment, HAART. This had brought about an immediate decline of between 60 to 80% in rates of AIDS-related deaths and hospitalization in countries that were able to afford it. 2000, UNAIDS negotiated with 5 pharmaceutical companies in order to reduce drug prices in developing countries. The United Nations adopted the Millennium Development Goals. This was a specific goal to reverse the spread of HIV, malaria, and TB. Ways of promoting health. Quantitative analytic techniques. Epidemiology acquired greater quantitative capacity during the 20th century. Improvements in study designs, periodic health surveys, and methods of data collection. Non-government organizations. Mothers Against the Drunk Driving. This was in the 1980s. Mothers Against Drunk Driving, started by a group of women in California after a girl was killed by an intoxicated driver, and grew into a national campaign for stronger laws against drunk driving. There was also sponsorships and public health research projects and programs. These sponsorships included family planning, human immunodeficiency virus prevention, vaccine development, and heart disease and cancer prevention. Local health departments. The Institute of Medicine defined assessment, policy development, and assurance as 3 core functions that need to be implemented. Federal government. In 1993, federal, state, and local health agencies spent around $14.4 billion on core public health functions. Pros and cons of individual control in public health. Pros. Free to do individual research on health concerns. This is a pro because an individual can go, for example, in this time period, go look up what they know about HIV and how to not spread it or contract it. But that could also be a con because the research that they look up could be incorrect, that could be misinformed, leading to poor public health. Another pro is it's easier to get an individual to follow protocols rather than a community as a whole. This being said, it's easier to try and get one person, for example, with HIV to not share needles with somebody else, causing transfer of HIV, rather than trying to get an entire group or community to. But that could also be a con because that's leading to thinking about their own health rather than the health of the community, because people are a little bit selfish. Not that there's anything wrong with that, but being selfish and just thinking about themselves rather than the community as a whole could lead to overall bad public health.
And then these are just the references we used for the assignment. Thank you.